Hi, I'm David Ward. For over 15 years, I've worked as a chiropractor with a specific focus on functional health, autoimmune disorders, and cognitive health. I'm a certified RECODE 2.0 practitioner of the Bredesen Protocol, a program proven to stop cognitive decline and enhance brain function. I was one of the first clinicians to be trained in this methodology in 2017. In addition, I've completed over 300 hours of postdoctoral education in nutrition and functional health care through Southern California University of Health Sciences. This has provided me with the tools to help many individuals restore their brain health, identifying the contributing factors to their cognitive decline and providing personalized lifestyle solutions for improved brain health. Many individuals in their 50s, 60s, and 70s tell me they're struggling with low energy, poor sleep, and recurring brain fog, dealing with declining memory, decreased focus and concentration, and an inability to recall words, names, or faces. Feeling like they're growing old before their time, even though their doctor says their tests are normal or it's just a matter of aging. They're concerned because they know that something isn't right and, frankly, not sure what to do next, but they know they have to do something now. If that's you, you're in the right place. One of the most frequent root causes is chronic neuroinflammation. You see, when you're inflamed, particularly in your brain, you can experience accelerated aging, cognitive decline, compromised brain health, and increased risk for additional chronic health conditions. So what happens if you don't get your inflammation under control? Well, your body thinks it's in continuous survival mode, so it doesn't fully heal, resulting in chronic systemic or body-wide inflammation. Systemic inflammation drives inflammation in the brain, and neuroinflammation has your brain on fire, triggering migraines, chronic pain, brain fog, and Alzheimer's disease. Can you see how chronic inflammation is literally wrecking everything, preventing you from enjoying a well-balanced, productive life, looking and feeling your best? We see these issues all the time in our clinic. The solution to neuroinflammation is much greater than treating individual symptoms. The real issue is the lack of a clear point A to point B system that's easy to follow, a roadmap for restoring brain health. A clear roadmap that's been proven to help you effectively prevent cognitive decline and restore optimal brain function. A roadmap to return you to a well-balanced, productive life, allowing you to feel and perform your best, regardless of age. This is where our neuroinflammation eliminator framework comes in. Let me walk you through it. At Entavida, we see neuroinflammation as a consequence of chronic deficits and prolonged exposure to toxins and promoters, putting your body and brain under constant stress. Premature aging and cognitive decline become the predictable result of unrepaired damage and delayed maintenance that's been going on for decades. The bottom line is this: we need to lower neuroinflammation in order to successfully address cognitive decline so that you can enjoy a well-balanced, active life for years to come. So when it comes to reducing neuroinflammation mediated by toxins, shown in the orange area in the top right, we need to minimize toxic exposure and reduce your body's burden from prior exposure to inorganics, organics, and biotoxins. This includes the safe removal of heavy metals. Think arsenic, lead, mercury, and cadmium. Regarding organic toxins, we educate individuals about solutions to avoid persistent pollutants, such as pesticides, plastics, flame retardants, industrial chemicals, and VOCs, which is short for volatile organic compounds. And finally, mold and tick-borne illnesses, including Lyme disease, are other frequent contributors to neuroinflammation that will keep your body irritated, inflamed, and imbalanced. Next, shown in the blue area on the bottom, we help individuals to identify and remove pathogenic promoters of neuroinflammation, addressing the downstream consequences of infections from viruses, bacteria, parasites, and fungus. Another promoter of neuroinflammation is increased permeability of your protective gut and blood-brain barriers, frequently referred to as leaky gut and leaky brain. We help individuals reestablish barrier integrity, support proper food digestion, and improve nutrient absorption by replenishing the microbiome. Finally, we look at signs and symptoms of immune system imbalance, including microglial activation, increased levels of inflammatory markers, as well as autoimmune and chronic inflammatory disorders. Additionally, it's critical to promote strategies to support healthy inflammatory response and keep neuroinflammation in check. In my personal experience, conventional medicine doesn't recognize these promoters, ignoring some of the most powerful levers to help your brain heal. Finally, the green area toward the top left focuses on chronic deficits that slow the body's repair and maintenance processes. Specifically for the brain, this means suboptimal levels of BDNF, brain-derived neurotrophic factor, and NGF, nerve growth factor, both of which are important for neurogenesis and neuroplasticity. Hormone imbalances, including reproductive hormones such as estradiol, progesterone, or testosterone, as well as thyroid hormones, insulin, and cortisol, are common deficiencies that not only impact brain health, but also restorative sleep and the body's capacity to efficiently repair and maintain resilience and proper immunity. For example, insulin resistance is not only commonly associated with stubborn belly fat, high blood pressure, fatty liver disease, and high blood sugar, but also contributes to the development of cognitive decline and dementia. Finally, nutrient deficiencies brought on by inadequate diet, poor digestion and absorption, or drug-induced depletion further hampers the body's ability to combat neuroinflammation. Therefore, we focus on pharmaceutical-grade supplements to replenish key nutrients such as vitamin D, DHA, vitamin B12, and glutathione. Unlike in conventional medicine, we teach our patients strategies for proper nutrition, movement and exercise, mindful breathing, optimizing sleep and stress management so their body and brain can function optimally. From a practical perspective, across all of our programs, we focus on a four-step approach: identifying the root cause, removing the triggers, repairing the damage, and replenishing the body. Also, unlike conventional medicine, in functional healthcare, we always start with advanced diagnostics to not only measure current brain function, but also to identify the specific root causes driving neuroinflammation. This allows us to create a targeted approach to address cognitive decline and associated brain-based conditions. Next, we remove the inflammatory promoters as much as possible, because when your brain isn't functioning optimally, the best first step is to reduce exposure to the contributors. But again, that's not common practice in most conventional medical offices. And finally, we seek to promote detoxification and optimize brain energetics to help your brain recover and maintain optimal resilience going forward. Again, not common practice, as conventional medicine does not have effective or meaningful strategies to stop and reverse cognitive decline. That's why at Entavida, we deploy an integrated, comprehensive approach addressing toxins, promoters, and deficits. This neuroinflammation eliminator framework is a critical part of our Entavida Cognitive Health Restoration Roadmap, a unique approach to help motivated patients prevent cognitive decline and restore their brain health so they can continue to live life fully, feeling their best. even if they've been told nothing can be done, their labs are normal, or it's just normal aging. As part of the foundation phase, we start with the patient's health history and advanced diagnostics. After reviewing lifestyle and risk factors, we typically run functional diagnostic testing with metabolic profiling to craft an individualized treatment plan. Next, we'll promote brain energetics and insulin signaling, optimizing diet and nutritional support, as well as cerebral blood flow and oxygenation. The third step in the foundation phase focuses on optimizing nutrients, hormones, and growth factors so we can stimulate and refuel your brain. This provides the building blocks for creating new connections between nerve cells. The next three steps, part of the restoration phase, focus on resolving chronic inflammation, addressing systemic infections, and supporting detoxification. We start by identifying and removing the causes of inflammation so we can halt the damage to nerve cells and synapse that's driving the cognitive decline. The next step is dedicated to identifying bacterial and viral infections, mitigating the body's inflammatory response to their presence. The last step in this phase is dedicated to detoxification, helping you reduce your body's toxic burden by removing identified toxins and supporting the body's detoxification process. Once we make headway with these areas, we'll turn our attention in the growth phase toward brain activation and stimulation, strengthening your immunity as well as enhancing cognitive function. At Entavida, we utilize a unique brain training program, integrating lifestyle-based stimulatory activities along with cutting-edge computer-based brain training. Next, we'll support immune function through sleep optimization, stress management, diet and nutrition, and targeted dietary supplements. The last step in the growth phase covers neuronal regeneration with specific protocols and treatments to support synaptogenesis, boost neurogenesis, and amplify neuroplasticity. This step serves to enhance your brain function so that previous cognitive deficits can be mitigated by creating new brain cells and neuronal connections. So, if you want to get clear on the exact steps you should be following right now to not only reduce your risk for cognitive decline, but also restore brain health, then request a discovery consultation at the link below this video. In just 30 minutes, you'll understand if Entavida's approach is right for you. Please note, this discovery consultation is only for you if you're actively looking for someone to help you address cognitive health issues, are open to explore beyond what you've already tried, are willing to make sensible changes, and are ready to invest time and money into your health now. If that's you, then click the link below to request your discovery consultation. We look forward to connecting with you soon.